Safari Africa, from the heart of the world.
1 in 4 of us will experience a mental health problem at some point in our lives. If it isn't you, then you can be sure it will be a colleague, friend, or family member. But what exactly is mental health? What does it cover? When most people come across the term mental health, they think about mental illnesses. Common cultural beliefs surrounding mental unwellness vary. For example, that mental disorders are caused by supernatural powers, for example, spirits and gods. That mental disorders are as a result of atonement for sins committed by the clan against the ancestors. Or that even mental disorders are as a result of being bewitched. But mental health is far more than an absence of mental illness. It involves asking ourselves the following questions, such as, how do I feel about myself? How do I feel about others? How do I meet the demands of everyday life? Am I able to cope?
Safari Africa, from the heart of the world.
According to Professor David Musimi in his book, Your A to Z on Mental Health, when we talk about mental well-being, we are talking about how well we feel about such things as happiness, peace of mind, ability to meet the demand of life, satisfaction with ourselves and others, as well as our desires, ideas, and even ambitions. Dr. Mwiti, a clinical psychologist and CEO of Oasis Africa Institute, tells us more.
I'm Gladys Mwiti. I'm a consulting clinical psychologist. I have a PhD in clinical psychology from Graduate School of Psychology at Fuller Seminary in Pasadena, California. But before that, I got my master's in counseling psychology at USIU, my bachelor's in psychology, USIU, and then before that, actually, I was in education. I had a high diploma in science teaching, so I taught high school for about 14 years. So Oasis Africa, we started actually as a mental health clinic, which also still takes a lot of the work that we do. Because we see clients here, individuals, couples, families, and so on and so forth, with all kinds of mental health issues. And I say mental health because as psychologists, we work from a mental health versus a mental illness perspective. There's a lot of difference. A mental health perspective is where you're putting a lot of energy into prevention of mental illness or mental health problems. You work a lot with those who come presenting with all sorts of issues, relationship problems, marriage, stress, retrenchment issues, retirement fears, and all kind of stuff. Remember, psychiatric illness or psychosis, most of it is chronic, like schizophrenia, where someone just gets crazy, or manic depression, which you call bipolar. Meaning one time someone is very hyper, another time they're very depressed. They go in cycles, yeah? So they are given medicine to be able to level the cycles, up and down, cycling. But many people, the regular person, will present with an illness that is curable because maybe it relates to the environment. There's something in the environment triggering the illness. So in this country, we need to be able to understand those two differentiations. The psychiatry treats mental illness. Now, psychologists are scientists of human behavior. They study cognition, thinking, and how those two relate to problems of coping with day-to-day challenges. Now, inability to cope with day-to-day challenges is normal. When someone feels challenged, it's normal. A parent maybe who has a child who is very sick, they'll feel depressed and they'll feel anxious. They do not need a psychiatrist to give them a pill. They need to say to their psychologist to find how they can control their anxiety. So that's the difference. Psychiatrists work on psychosis, psychologists work on mental health.
Safari Africa, from the heart of the world.
In its World Health Report of 2001, The World Health Organization stated that 450 million people alive today suffer from mental disorders and psychosocial problems such as alcohol and substance dependence, and the majority of them suffer silently. 1 person in every 4 will be affected by a mental disorder at some stage of life. Not only that, its 2003 report found that mental and substance abuse disorders are a major contributor of the overall global burden of disease. A large portion of individuals do not receive any healthcare for their condition because the mental health infrastructure and services in most countries are grossly inefficient, largely due to prevalent stigma and discrimination of patients requiring those services.
Safari Africa, from the heart of the world.
Looking at Kenya, current figures from the Division of Mental Health, which is based within the Medical Services Ministry, show astounding figures that 12% of Kenyans have mental problems that need intervention. That is over 4.8 million people. Not only that, children are quickly becoming a separate and distinct segment of those suffering from mental health issues. According to the Mental Health Division Director, Dr. David Kema, children in Kenya as young as preschool age all the way to teenage are affected. Dr. Mwiti tells us more.
These problems that people carry from day to day, children getting abused and beaten at home. Now, as the nation addresses the suicides from KCP, KACE is coming. Is anyone talking about it? Actually, right now, I'm trying to get away into the papers and into the media houses to talk about how do parents prepare their children to receive the results. We are really in crisis, the mental health in the schools. Head teachers do not know how to recognize children in mental distress.
Safari Africa, from the heart of the world.
During last year's World Mental Health Day celebrations, experts both in the government and the private sector narrowed in on what has been described as Kenya's most worrisome but least addressed problem: stress. Dr. Kalia, a professor of psychology at Mount Kenya University, elaborates.
Post-traumatic stress disorder, it's a real one. I would say child trauma also is a real problem that our society has not comes into terms with. Many children underwent trauma because of different situations. The challenges that these kids go through are never addressed because our society in the first place doesn't appreciate mental health as a challenge. So those will be cases in scenario. Not forgetting issues like depression, stress-related challenges of mental health. So at least I would highlight at least those ones.
Dr. Mwiti, a clinical psychologist and CEO of Oasis Africa Institute, tells us more.
There is diversity because mental health expresses itself, or mental illness or mental struggles express themselves depending on the culture of the people. However, there is an overriding problem that you find cutting across. Professor Nyang was saying last year that 1 in every 4 Kenyan is struggling with mental health issues. 1 in every 4 is 25%. Now, the major overriding problem for Kenyans right now is stress and trauma. Stress is rampant. Like, for example, with the current inflation, we have people listening to this program right now who don't know where their next meal is going to come from, who don't know how they send their child to school, who don't know how they're going to pay their rent. So they are really stressed. IDPs, sleeping in the same tent with 9 kids. Stress also can come from fear of retrenchment. For example, one of the programs we do a lot is working with companies that are just about to retrench. Some companies are very clever. They actually care for their employees enough to give them training before they are given the letters to be sent home. Other companies would care less. So what? Get your letter and take yourself off. Companies where people know they might be retrenched, actually anxiety levels go very high. If you think your company might retrench, you start having your acid in your tummy and the headaches from stress. And that is not a psychiatric problem. That's a psychological problem. So there's a lot of anxiety, a lot of stress.
Safari Africa, from the heart of the world.
According to the World Health Organization, in most countries, particularly low and middle income countries, mental health services are severely short of resources, both human and financial, with more being spent on specialized treatment and care for people with mental illness than on working to integrate the overall healthcare system to incorporate mental health care. In the second part of this series on mental health care, we will get into more detail on exactly how far the government has gone in implementing and integrating mental health care into the overall healthcare system, and more importantly, what kind of training regimes exist in various colleges and institutions in the country. Are medical personnel and professionals prepared for the challenges that Kenyans are currently facing in terms of mental health? Stay tuned for the second part of our series.
Safari Africa, from the heart of the world.